Moderator of the next session, Jozef Šuvada. Now it works.
Good afternoon, dear ladies and gentlemen. It's my great privilege to be today with you. And my name is Jozef Šuvada. I am involved in global health policies and global health security and safety and clinical guidelines development. And today we are having the panel which is really essential for the health security and also health safety. This is crisis-proof healthcare, securing Europe's access to affordable medicines. And this year's summit is driven by clear strategic message, which is resilience in the new currency as a power. So where we are talking about the health security, it is not only related to the defense and not only related to the regulations, but it is having a lot of components. And today's session focuses on how Europe can turn vulnerability into resilience. By reshoring production, strengthening supply chains, accelerating innovations, and ensuring equitable access to essential medicines. I'm honored to be today with a very specific and special guest who is involved in many not only domestic but also European policies development. And please join me and welcome Mr. Jakub Dvořáček, Deputy Minister of Czech Ministry of Health, distinguished,
it's good to see you.
Distinguished speaker, and let me introduce you also to our speakers, that you are not only involved in the policies developments at the Czech Republic recently, but also you are having the influence at the European level. And before we are going to continue with the session, allow me to invite you to use the Slido to join us during our conversation with your questions. And the Slido, you can find hashtag GLOBSEC forum SCH, hashtag GLOBSEC forum SCH, and you can provide us with your insights and questions, and we will come to Q&A questions later on. So, Deputy Minister, let me start with very essential topic, which is framing our today's discussion, and this is a reflection on COVID-19 pandemic, but also other recently experienced emergencies within our region, but also beyond, which clearly demonstrated the risks of really depending on long and also fragile pharmaceutical supply chains. And we have seen growing really momentum at the European Union level to bring back the production of the critical medicine, but also active pharmaceutical ingredients. So I would like to start our discussion with your thoughts on what would you actually make reshoring not only possible but also economically and politically viable and sustainable for European pharmaceutical companies. Could you provide us with some your thoughts on it?
No, first of all, thank you, and it's a great privilege to be here. The GLOBSEC is an amazing session. And I believe that during the time there will be more people joining the healthcare topics. But yes, I believe we are in a very special situation recently. We have the draft of the Critical Medicine Act on the table, which is quite a long work for all of us. It's more than 1 year when we start to work in Critical Medicine Alliance to prepare it. And yeah, it's a response on what you highlighted in the opening speech. We are facing quite a lot of fragility in supply chain of the pharmaceuticals. But if we focus, on what we try to solve, in Critical Medicine Act, it's mainly the area of, I would say, critical medicine list medicines, which are the medicines important for public health, And if you take the list, those 350, 360 molecules, it's dominantly the molecules which are generic, which are used for a wide population, and which were, let's say, agreed between the member states and the EMA as essential for, let's say, treatment of the big population of the patient. So with the Critical Medicine Act, we're mainly targeting the response to unavailability of the basic medicines, very old, or let's say the older one. But it's not the same, with the innovations. That's not the direct tool to support, let's say the I would say retention of the pharmaceutical industry in the innovative industry in the Europe. So if I should focus, on what we faced during the last 2-3 years with the unavailabilities as the generic medicines, yes, the Critical Medicine Act should be the response, and it's really consists a number of tools which we believe could make the Europe more resilient, in this field.
You highlighted it really very clearly that this is not only about political courage, but also about the coordination and economic sustainability, just to reflect what really basic needs are and what the basic list is. And we know that we need to reflect also on the current changes, because also health of the population is currently really facing to different challenges. And this is bringing us also to the point of citizen preparedness, not just the system preparedness. So many countries are facing really disparities in capacities and infrastructure, which limit their ability to reflect and react to upcoming and potential emergencies, especially those which are from and within the small and middle-sized regions. And this is bringing me to second question: how do we see European Union member states translating those EU-level framework into concrete citizen-level preparedness, especially in countries with varying levels of health, public health infrastructure, and also resources? And perhaps you can elaborate also on concrete tools, perhaps investments frameworks, but also coordination mechanisms, how we can perhaps bring this EU potential improvement in this Coordination Act into the real-world practice.
So if I understood properly, I should focus on the CBRN and the crisis preparedness. Yeah,
perfect.
And but we can then build on it, of course. It's a very special discipline. Yeah, and I mean, we have for a certain time the new directorate at the EU level, the GHIRA, which is supposed to be, so the agency for emergency crisis response. Yeah, but at the same time, when we take the country by country and our preparedness for the situations which could come, doesn't matter if it is the chemical, biological, or the radiation, or let's say and other, let's say, measures which could appear. I have to say, that the majority of the countries are not really ready. If you take, our supplies, our preparedness from perspective of those molecules which have, let's say, the both use, let's say, the normal for treating the patients with some disease, and the second, for example, the usage, for people, who get, to be contaminated with radiation, or let's say, with any kind of biological attack, etc. We are not really updating the lists of those active substances and medicines which we can use it.
Why is it so?
And the problem is, that it's a very difficult discipline, I have to say, because you are preparing for something what you hope will never appear. It's very difficult to say, how wide part of the population could be affected. It's also very costly. And we lived, in very safe environment for generations, and to use the public money to create, this kind of stockpile or contingency stock, it's quite costly, and it's difficult to really defend it. This cost, which very often finished with the expiration of those pharmaceuticals or agencies. Then we can see, how, for example, US is preparing, how the BARDA, the agency for those preparedness in US, is building their stock. Not just the stock, it's also good to highlight it that for the secondary use of some of the medicines, we don't have clinical trials. It's quite obvious why it is so difficult. So we have no registration for this use. And for example, the US BARDA is doing that. As an agency, they funding those kind of clinical trials. They funding the research. They also closely work with FDA to get this special use as the added value of those medicines. We don't have it in the Europe. This kind of approach. So then it's also very difficult to justify it. Yeah. So, but it's changing. It's changing, and HERA is start building this contingency stock on the EU level. We have also the emergency stock, which is under the DG ECHO, and those special mechanisms to use it. And some of the states are, let's say, storing those kind of medicines for those situations. But we are, let's say, pushed or motivated also to do it, on the national level. We start to build. We start to prepare also as a Czech Republic. We have a new tool which is quite unique. We are calling that reservation system, and our state reserves institute has a new right, or let's say the new chance to not just to purchase and store, but also to reserve those kind of medicines. We start to work with that with the normal medicines to see how the system can work, and now it's the next step. We will try to build this kind of stock of essential medicines for those special situations, the CBRN, also in the Czech Republic. The reason why, and why I try to also justify it with the Czech government, is that the time which is required to use those kind of medicines for certain situations is usually very short. You have to have it in hours, maybe in days, but not in weeks or months. And we get just recent experience as a Czech Republic with one substance. It was the substance against the poisoning of cyanide, for example. And that pharmaceutical was not available for a certain time in the Czech Republic. So we try to use the mechanism which I described before, this emergency mechanism on the European level, to see if this could fly and if this could quickly bring at least the small stock of those antigens to the Czech Republic. It took us, I think, 3 weeks. So I think the people who will be in that situation will probably die much earlier before we will be able to get it. So we know it exists, the tools are there, but the speed and time we need to bring it to patient, it's very short. So we need to build it our own and use the system which we have. The wholesaler system and pharmacy system, because this is probably the speediest way, how to get this special medicine from the warehouse directly to the hospital or to the patient. So I believe in coming years we will build at least the essential part of that stock, which we will need it for our people.
Perfect. You addressed also flexibility or need for flexibility, but also context sensitiveness, because context is really important and each country has a different one. And this approach should be also facilitating driver for the future implementation. And as you mentioned, that even US efficiency and their agency, which you mentioned, they are having alliance with academia, and therefore they are able to provide also academic studies, clinical trials, which we very probably need to reconsider also how we can implement in now and our context. Due to the constraint of the time, and this is really a huge topic, and we would like to sit here the whole day. We can open up also Slido questions to and from our audience. If someone would like to raise the hand who is in the room, so I would request everyone who is going to share with us thoughts and the question to share only one question per person, and then we will continue with the slide. So who has also intention to put a Slido question, please feel free. So I see in the first queue, lady, please.
So I have a little question for you. If did you learn something from Ukraine with the emergency crisis? Did you implement something from our country in Czech Republic? Because it's like 11 years of war, you know.
If you're asking me, I mean, what we can learn from the Ukraine, from those emergency steps, a lot. I believe it's something, very unique. We are in touch, with the Ukrainian Ministry of Health. We are also in touch with the hospitals there, and there is quite a lot of exchange between, our teaching hospitals and the Ukrainian teaching hospitals. We also try to see, how the Ukraine works, with those emergency supplies, and how quickly, you can move those supplies, between the healthcare providers. So we are in touch. It's definitely something. If I can highlight it, the one thing, which we are working on it is, for example, the exchange in the urgent care, because of course, the medical professionals at the Ukraine, they have quite a high level of experience now to treat the people with special wounds and special, let's say, health issues. So the Ukrainian doctors, coming from Ukraine, to get the training here in the Czech Republic for, let's say, the different issues. They are also, let's say, helping our people, our specialists, to be prepared, for potential wounds, like those, which are coming, from the war. It's also, I mean, the area of preparedness of what kind of supplies, what kind of medicines we should have, in our contingency stock in the reservation system. And it's obvious, that what we had before the crisis, before the war at Ukraine, and what we are now, let's say, building, it's quite a different, because we get a lot of information and experiences of kind of supplies we needed, and it's not just the medicinal supplies. It's also the bandages, and also those things which are using for emergency medicine. So that's flies, that works. And I believe, I mean, also in the future, there will be a continuous cooperation in the field. So, yes, and I have to say that with the Ukrainian Ministry of Health, we are in very regular contact on this topic.
Thank you very much for the question, and we will go to the slide. And I see there the first question: what concrete things have you learned from the COVID-19 pandemic, and how member states implemented them into their daily practice? So, could you perhaps share your experience from?
It could be very short answer. That the crisis like COVID cannot be solved, on the national level. That's, I think, the main learning. That, I mean, if the Europe, can really build something, it's the joint response, on the crisis like this, and that alone, the small country cannot really be able to do the research, do the production, to ensure, the capacities of the system. And this is also the reason, why we become really active as Czech Republic, in the development of the pharmaceutical package, of the Critical Medicine Act, and also, the work of DG HERA. That's definitely, what I would, make it as a let's say general but very important learning, from that situation.
Thank you very much, because we know that also Czech Republic published very, very huge analysis of the COVID lessons learned from the public health perspective, but also from the society and different whole of governance approach, and also possible reform substances as the background. And this is really something what we admire, for example, from my home country. And this could jump us directly to the second question. Are you worried about sustainability of our healthcare systems? We have the topic about the resilience and vulnerabilities, teaching us a little bit to be more resilient, but are we really worried about it? In nowadays, in the Europe, in the context of uncertainty?
It's not the worry about the system itself. I believe the Czech healthcare system is very robust, and I mean, we used to complain as Czechs, about the quality, waiting time, etc., etc. But if you compare how the Czech system works, and not comparing, with incomparable, but with the countries in the EU, but also, with the US, it's very robust. If we will be, the different question is, if we will be able to sustain the same quality and increase the quality and access to new treatment in the future, because of course it depends, on number of factors. It's definitely a lot about the economic, let's say, development of this country, how we will be able to invest. But even more, what I believe, how we will be able to evaluate what are really the technologies, which are, let's say, essential and which brings the most added value to our patient. Because, it's clear that no country can really afford to pay for every innovation which appears, at the market. It's just not manageable. And, we have to be really very, let's say, in detail how to work with data and how to acquire those data which are essential for proper HTA. Yeah.
You are absolutely right, and this is bringing us also back to the vulnerability of what defines opportunity to be more resilient. This is window of opportunity. We need really to recognize when there is a chance to use theory of change and to understand what component it has to be on the local level, but also on the European level. So I would like to appreciate your thoughts, your wisdom, your experiences which you have shared today with us, and also the audience for great questions and that you joined us. And allow me just to share a last announcement from organizers. Rapid response panel will take the place at 6:05 in Schwanzerberg here in this stage. And Amos Yadlin, founder and president of Mind Israel, former head of IDF, of military intelligence, and he will be presenting the topic recent escalation between Israel and Iran. So you are most welcome for this special topic. And thank you very much for your joining us today during the lunch break and very, very heavy digest or the food to digest. Thank you.
No, thank you very much.